morning.
Good morning.
Hi, so I have reviewed your plan of care. I've washed my hands. My name is Francisco Viafana. I'm going to be your student physical therapist assistant for today. Can I have your first and last name?
Kaylee Duke.
All right, may I call you Kaylee?
Yes.
Okay, so I see here that you're coming in for a left shoulder injury. You said that there's pain located there. You've seen some inflammation going on. So how did that happen?
Playing tennis.
Playing tennis? Okay, so what other functionalities have been going on that it's difficult for you to perform daily activities? Or the pain gets worse?
Like lifting my arm up to here, like laundry, things like that.
Mm-hmm. Okay, at rest when you are just sitting down, how would you rate the pain there? From 0 being nothing to 10 being the worst pain you ever had?
3.
3? And how about with the activities like doing laundry and everything?
Like 7.
Okay. So what we're going to be doing today, the purpose of what we're going to be doing is an ice pack application. The ice pack it's to reduce the pain and to reduce the inflammation. It's going to take around 10 to 20 minutes. My expectations of you is please communicate with me. We're going to be doing some sensation testing. So just let me know everything that I'm going to explain. If the temperature is too much, just let me know.
Okay.
Do I have your consent to proceed?
Yes.
Okay, so I have a few questions before we start doing everything. Do you have any cold hypersensitivity?
No.
Has the doctor diagnosed you with cryoglobulinemia?
No.
Any paroxysmal cold hemoglobinuria?
No.
Any Raynaud's disease doctors diagnosed? We're not going to do it over any regenerating peripheral nerves. We're not doing it over an area with circulatory compromise. Not over a superficial main branch of the nerve. There's no open wound, so we're not doing it over. Any hypertension problems that you have?
No.
Mentation is good. You're answering my questions well. Poor sensation on that area that you have felt or noticed?
Yes.
A little bit? Okay, we're going to do some integrity sensation. And you're not very young, that you're less than 3 years old, or very old, that you're more than 70, which would unqualify you for this. So we're going to proceed with the treatment, okay? And now you're already on the area, that's good. We're going to start draping. You're pretty good with that. Okay.
Okay.
How's that, okay?
Good.
Big towels for you.
It's okay.
So now we're going to be doing some testing around that area. We're going to do your unaffected side first, which is your right side. Your left side is the one being affected. Both sides is just temperature comparison. Temperature is normal for both sides. You don't have any bruising, rashes, or redness around those 2 areas that I'm looking at right now. As we said, there's no open wounds. We're good. So now we're going to be starting off light skin sensation. You're going to be feeling this, okay? And your parts of the dermatome, so this is going to be your C4, C5, C6, if you put it upwards, C6, C7, C8, and T1, okay? Now for patient conformity, we're going to be putting this pillows under. To make you comfortable. And a pillow on your back, so if you could scoot forward, you have the towels as capes.
Yeah.
There you go. Comfortable?
Yes.
Okay. So now we're going to be starting on your unaffected side, so please close your eyes. If you feel that sensation that we just did, so I'll do it again, you just say yes. Okay?
Yes. Yes.
Palms facing up.
Yes. 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 Yes.
Okay, good. Right side is good. We're testing the left side. close still.
Yes. 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 Yes.
Good. Sensitivity is good. Now we're going to do some hot and cold. Alright. So first I test it on myself, checking that it's not too hot. A little bit hot, so let me pull it off first. Okay. Much better. Now it's proper temperature. So this is what, so palms facing up, this is what hot is going to be.
Okay.
Good. This is what cold is.
Okay.
Alright, so now close your eyes. So you're going to tell me if it's hot or cold on different parts of your dermatome, okay?
Okay. Hot. Cold. Cold. Hot. Hot. Cold. Hot. Cold. Cold.
Okay, good thermal sensation on the right side. Now let's try out the left. Same thing, close your eyes. Put it up.
Cold. Hot. Cold. Hot. 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 Cold. Cold. Cold.
Okay, perfect. So good sensations on both sides. That means that we can do the ice pack application. So we're going to put this whole pack right here. We need a towel wrap. I'm gonna undrape you from here.
Okay.
And we're just going to be placing this over here. Remember, we're going to be leaving it for about 10 to 20 minutes. I'll leave this with you. Ring it if you have any, if it's too much. Remember, please communicate with me. If it's too much, ring the bell. I can come over. For now, I would just leave it on.
Okay.
That's going to be treatment for right now. Let me take this off. So one thing before I leave, I need to explain to you what's going to happen while you're feeling that cold pack right there. You're going to be feeling cold first. Then it's going to be a burning sensation. Then it's going to be an aching sensation and a numbness sensation. So once you're feeling that numbness, we can stop the treatment. So that's why you're going to have that bell right there. So please ring it. Now, I'll come back in 5 minutes. Okay?
Okay.
5 minutes have passed. Just take the ice pack away. So there's a little bit of redness that's normal with the application of the ice pack. So how are you feeling?
Good.
Any,
Well,
a little numb? Okay. So since it's a little numb, we can stop the treatment right there. We're gonna take this off. This. Okay, so now that it's off, we can check the integrity again. It's a little bit red, it's all right. There's no adverse effect like having a rash right there, any abnormal skin abnormalities that you might have. Everything looks good.
Okay.
So with the application, what would you rate now the pain that you're at rest?
At rest, about a 2.
2, so we did have a good reduction of pain. Now, do you have an ice pack at home?
Yes.
Yes? Okay, so that iPad is good. Remember, if follow the instructions that it says right there, use proper draping, so put it under a towel, just put it on. Normal application for an ice pack, I would recommend it. It's recommended that you do it 1 to 2 hours.
Okay.
If the pain is persistent and anything like that, just 1 to 2 hours, let it rest for a little bit after the application,
Okay.
and you'll be good. Any questions for me?
Nope.
All right, thank you very much, and I'll be seeing you.
Thank you.
One more time. Okay, so now we're going to be doing an ice massage. For the ice massage, everything is pretty much the same. You go on and review the plan of care, grab your equipment, ask all the questions that are necessary to the plan of care. Once we have done that, we ask our contours and precautions that are going to be the same for the ice pack. Once you do all that, make sure that there's no jewelry in the area. There is draping, proper draping for the ice massage that we're going to be doing. Water's going to drip, so make sure we have a towel, pillow for conformity. You still have her set up with the pillows now that she's sitting up. Once you do that, we check for skin integrity again. We look for bruising, we look for redness, we look for temperature change. Temperature change is done with skin to skin contact. You check the other side with your hand and check this side to see if there's any differences on both. Once you do that, you still do light skin touch sensation with the dermatomes, hot and cold sensation, and after everything is good, we start with ice massage with the cup. Now the ice massage with the cup is good for smaller areas that are going to be like for lateral epicondyle, or the ice pack is going to be for larger area, which is going to be the shoulder, knee, hamstrings, or quads. Right now you're going to get an ice cup. Try to rip it all around. We're trying to leave a little bit of the plastic on there so it's not too harsh on our hands, and we're just going to do small circles around that area for 5 to 10 minutes. As you can see right here, just small circles. Let me try to angle it a little bit better. Small circles around here, and you explain to the patient. First, you're going to be feeling that sense of coldness, then you're going to be feeling burning, then you're going to be feeling aching, and then numbness. Then we're doing this for 5 minutes. Sometimes the numbing sensation comes faster because some people have more sensitive skin, some have different body temperatures, so it just depends on the person. So that's why we keep asking, we keep communicating with the patient to see how she's feeling. Let's say right now, what are you feeling right now with this?
Still burning.
Still burning. So we're in that second phase right there. We do small circles over that area. We can see the ice melting. This is how we do the ice massage. So after a little while, we ask again, how are you feeling now? Are you feeling that aching sensation, that numbness?
Mm-hmm.
What is it that?
More towards numbness now.
More towards numbness. So once we hear that numbness part, we can stop our treatment, clean it up, and once again, once we do all that, we ask for the pain levels. We educate the patient that if she's going to be doing this, it would be just like how we did, or we can recommend an ice pack, a smaller ice pack to cover the small area.